You're welcome back to Hello Nigeria, and stay tuned for part 2 of Olive teaching us how to make a sponge cake with Chef People. It's time for us to switch gears and talk about something else. Today is Tuesday, and as you know, if you're regular on Hello Nigeria, you know it means Hell Tuesday. Today we have Dr. Amadi Godspower Doro. He's a PhD holder in electro-homeopathic medicine from DHMS from International University in Alternative Medicine in India. He's consultant physician at Boundary Specialist Homeopathic Hospital in Lagos, and is currently the chairman, Lagos State Chapter of National Alternative and Complementary Medicine Association of Nigeria. Thanks for joining us on Hello Nigeria, sir. And today we'll be looking at the condition called hernia, the medical condition called hernia. What is hernia?
Thank you very much. Hello, Nigerians. Good day, Nigerians. Thank you for this, this opportunity. Well, hernia is a medical condition that means a painful contraction of the abdomen due to protrusion of internal organs, just like the intestine, through a weak connective tissue, usually found in the muscle fiber. So this protrusion, because of its abnormality, causes severe pain. So it's a kind of abnormal gripping in the abdominal viscera that cause pain.
Yes. Are both gender susceptible to?
Yes, it can happen
hernia?
in both males and females.
But males are more susceptible to having hernia, or it's balanced?
Not quite, not quite. The balance is there. As it's found in males, so it's found in females.
So what causes hernia? What is the cause of this condition?
Well, the cause of hernia, they are varied. Sometimes it's found most commonly in people who engage in hard works.
Or like
take for instance,
labor.
yes. Take for instance, lifting heavy duties, mechanical things. You can see people, the laborers.
Strenuous activities.
Strenuous activities. Because of that, sometimes the muscular ligaments that enclose the internal viscera become weak. So sometimes that can just result this introsubception of the intestines through any weak point in the muscular region.
So will I be right to say that people that engage in bodybuilding and extreme sports can also run the risk of
yes,
hernia?
sometimes they experience that. But then also malnutrition can be a part, a causative factor there. And because during malnutrition, the body is not well built. So if not, people who are engaged in strenuous exercises would have been everyday victims. But most times, because of the good nutrition and good body building, then the muscles are maintained. So there may not be such an easy occurrence.
So what are some of the symptoms to look out for hernia?
When hernia occurs, you can see first and foremost the pain, the gripping pain in the abdomen. And it can, because we have the different types of hernia, it can be inguinal, it can be femoral. So when you look out for the signs, one...
Sorry to cut you short.
Yes.
Can you explain inguinal and femoral type of hernia?
Yes, the inguinal type of hernia is the hernia that occurs when the intestines prolapse or protrude through these weak ligaments, through the canal we call the inguinal canal, that actually leads into the scrotum of men. So in this case now, it is common in men.
Okay.
You see. Whereas femoral hernia is the type that protrudes through the opening that is closest to the femoral bone. You know, the femoral bone is the bone that's linked between, from the hip bones down to the knee. Yeah. So the lateral part of the abdomen the space therein, when there is this protrusion that goes through that place, it is now femoral hernia. Now, in both of them, the main characteristic is pain. And then in some other ones, there could be vomiting because of the severe pain and
Is
contraction
it pain in
and
particular
constriction.
areas?
Yes. When this intestine protrude that place, either through the inguinal canal or through the femoral canal, then there can be this constriction. So when this happens, there can be vomiting. And apart from that, there is the severe type where there is actually fecal vomitings. When somebody, instead of passing stool through the normal place, it's retroversed, and then the person can now vomit.
Orally?
Yes, orally. So these are some of the signs.
I'm sure that's in extreme conditions.
Yes. So severe pain, sometimes doubling up, bending double. When someone has severe gripping in the abdomen, most times people want to double up, want to bend down and double up. These are the signs.
But is there any physical signs? Like if you look at the stomach, is there any protrusion? And
yes, of course. The main physical sign when one undresses for examination is the protrusion. Because, you know, the abdomen as it is, the skin, underneath it, the fats, then followed by the fascia, then the muscle, before the intestine. So if this intestine, because of the pressure of peristaltic movement of food by occurrence or by condition, has any weak spots in the muscular region, then this can protrude. When it protrudes, then it can be visible. When it is visibly seen, this can enlarge to a great extent. Like in the inguinal type, you will see that the scrotum is now full and enlarged. And then as diagnostic, one may be asked to kind of cough. When one coughs and the pressure comes more, that is a sign that this is inguinal hernia. You see.
So what treatment options are available? And do patients have to go under the knife to correct hernia?
Yes, it all depends on the type of hernia and the type of Medicare the person is trying to assert. In the allopathic medical system, I think they will like to employ knives and all the rest of it as in surgery. But in homeopathic therapeutics, depending on the type of hernia, as I said, if it is inguinal, then we have certain remedies. Take, for instance, the remedy we call Nox vomica. These are usually seen in patients who have sedentary life habits. They usually take to alcohol, great stimulants, they are great coffee takers, and in fact, they engage themselves much in mental work, office work.
Rather than
so these sedentary habits makes them take stimulants. So whenever their muscular ligature is weak and there is protrusion of these internal organs, like the intestines, Nox vomica becomes their remedy. One of the characteristic signs for this Nox vomica is ineffectual desire to stool. They want to stool, but there is nothing coming. There is another more complicated type, especially in children, when we call the umbilical hernia. So this protrusion now occurs in the umbilical region, especially in children, either due to maldevelopment. Usually they have big heads, and they sweat more in the heads. So when this protrusion comes, then we have the remedy we call Calcarea carbonica. Calcarea carbonica, yes, it's homeopathic remedy. It has the tendency to rebuild and reconstruct and amend the weak side of the muscle, and as well correct the whole thing, and then the child will live. There is another type which we may call the Crocus indicus type. In this type is a more chronic form of hernia, in the sense that the inguinal type may be of both sides, both left and right. And when it is so, it becomes a heavy sack. In fact, the man is carrying heavy load.
Oh, I've seen pictures of that.
Exactly. Yeah. So this will now cause a lot of contraction. We say it is constricted, strangulated, and calculated. So the whole abdominal viscera goes in. In this case, the man may not be able to pass any stool. If there is any stool, they are always round and black. if there is any. And most times, because of this intussusception, there is fecal vomiting too, and the whole place is sore. And then the another type is the sulfuric acid type. Before you see the patient is already smelling sore. And most times when there is vomiting, the teeth are placed on edge, just like when you are licking on ripe lime. That is the sulfuric type. So there are many...
And is it one treatment type that is available or different treatment
That is what I'm saying. Because of the method of available in homeopathy, ailments are treated according to their symptomatology.
Now, before we move on with hernia, just shed some light on homeopathic medicine. And is it Western medicine?
Yes, of course.
And how is it different from the regular type of medicine?
Regular type. Thank you very much. You can see that the World Health Organization recognizes 3 forms of medical treatment. The allopathic system of medicine, which we commonly call the orthodox medicine here in Nigeria. And then this homeopathic method of treatment, which is under alternative and complementary medicine. And then the third one is the herbal stroke traditional medical system. So this homeopathic system, as the name implies, is a compound word that houses 2 simple words, homeo and pathic. Homeo means similar, pathic means suffering. That is similar suffering. So when you are using something that has the power to cause a disease, you are using a similar disease to treat that condition. When you are using something opposite, the causative factor, you are using anti, as in orthodox medicine. However, it might interest you to know that the orthodox medicine here in Nigeria, in some other country, becomes non-orthodox there, while homeopathy becomes their orthodox medicine there. So homeopathy is the system of medicine that use things that have the power to cause diseases to treat such diseases.
How receptive are Nigerians to it? And is there a large community of doctors that practice homeopathic medicine?
Yes, of course. It is slow anyway. But then in 1988, the federal government put down a law, we call it Decree 78 of 1992. The decree makes homeopathic practice to be regulated by the Medical and Dental Council of Nigeria. So the same council that regulates the orthodox doctors do regulate homeopaths.
Fantastic. Yeah. Now, before we let you go, once somebody has been cured of hernia, is there a chance of it reoccurring?
Yes, if precautions are not taken. If one is relieved of hernia, then the person has to be sure of maintaining good nutrition to make sure that the muscles do not weaken again, because that is the causative factor. When the muscles that hold the intestines in place get weak, then there can be a rupture anywhere. And secondly, the person should not engage in strenuous exercises, which may predispose him to such conditions.
This applies to everyone across the board, whether you've suffered hernia before. These are precautionary measures one can take to avoid getting hernia. Proper diet, eating well, and then avoid strenuous activities.
Exactly. And also to look out on your children and make sure they are not malnourished, because this brings to, the laxity of the muscles. There is also the third type, which is very dangerous, especially in children too, the hiatal hernia, which is experienced at the point where the diaphragm, where the esophagus passes through the diaphragm. So when the part of stomach prolapses through this region, we have hiatal hernia or hiatus hernia, which can actually cause hourglass contraction. So the child can neither breathe well nor expel well, vomit steadily, and cannot eat. So, but when you watch out your children and see if they are malnourished, then you take appropriate care to meet your doctor in time so as to preventing that.
Thank you very much. It's been an absolute pleasure talking to you, Dr. Amadi Godspower Doro. Do you have any social media portals that people could reach you on if they have any further questions?
Can meet me on Facebook.
Okay.
Dorobuchi Godspower. Yes, Dorobuchi Godspower Amadi. That is actually Dorobuchi because it's an Igbo name.
Oh, okay.
Dorobuchi. Godspower. It's just the musicians that turn it the other way around.
Made it very popular. Thank you very much once again, Dr. Amadi.
Also on YouTube, you can check on Boundary Specialist Hospital.
Okay.
Then you can see more and throw your questions.
Thank you very much. And Dr. Amadi Godspower is currently the chairman, Lagos State Chapter of the National Alternative and Complementary Medicine Association of Nigeria. We'll go on a quick break. When we come back, we'll show you part 2 of Olive's Hello Nigeria Taste It.
To enjoy more of these our Ogbonge videos when you just watch, press this button to subscribe on top of our YouTube page. You go love am.